Good afternoon, everyone. So, my next topic of the video, which I'm going to discuss with you, is on aminoglycosides, which are another protein synthesis inhibitors, which I'm going to discuss with you in this video. And before I start my video, I want to request you that if you like this video and if it is helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitikahan's Pharmacology Discussion. And now I'm starting with aminoglycosides, which are another protein synthesis inhibitors. Now, drugs under this category is mycin group of the drugs like amikacin, neomycin, gentamicin, tobramycin, spectinomycin, streptomycin, cecomycin, netilmycin, kanamycin, tobramycin, flamycin, or soframycin. Means mycin group of drugs, and these are the drugs in this category in the aminoglycosides. Now, mycin groups are like mycin, MyCin, streptomycin, it's obtained from Streptomyces griseus, and MICin, the drugs ending with MICin, or like gentamicin and cecomycin, these are obtained from Micromonospora. These are the natural products, semi-synthetic derivatives of compound, which are obtained from the variety of the soil actinomycetes. Semi-synthetic amikacin is a derivative of kanamycin, and netilmycin is a derivative of cecomycin. So chemical structure is that they are having the two amino sugars, which are joined by the glycosidic bond to the non-sugar moiety, and this non-sugar moiety is the streptidine in case of the streptomycin, and in other aminoglycosides, this is deoxystreptamine, which is the non-sugar moiety, which is in other aminoglycosides. These are attached to the amino sugar, and this deoxystreptamine is present in between, and it is joined by the glucosidic linkage. And the streptidine and deoxystreptamine are also known as aminocyclitol or the non-sugar moiety. Mechanism of action is that these are having they are bactericidal in nature. Means they inhibit the protein synthesis. How? By attaching to the 50S ribosome, they cause misreading of the mRNA, or they inhibit the initiation complex of the mRNA. So they also cause the misreading of the mRNA. So codon of the amino acids is not correct. So the wrong amino acid chain is formed, and that will lead to wrong protein synthesis. And that protein which is formed is cidal in nature. And this bacterial killing in this case is concentration dependent. Why? Because when these ribosomes, they get inactivated by the misreading of the mRNA or inhibition of initiation complex, the new ribosomes takes time to be synthesized, and that time taken is the reason of its concentration dependent. More is the concentration, more will be the effect of that bacteria. And post antibiotic effect is that the residual bactericidal activity persisting after the serum concentration has fallen below the minimum inhibitory concentration. Means the effect remains in the body even though the concentration has fallen about below the minimum inhibitory concentration. And we can say that the once daily dosing is effective in case of aminoglycosides, and they act for a longer period of time. And that can also be the reason for its reduced nephrotoxicity, and once daily dosing is sufficient. The duration of this effect is also known as concentration dependent. This is also concentration dependent. Mechanism of action is that they penetrate the cell wall by in the periplasmic space through pore channels. By the passive diffusion they can enter, or they can also enter through the cell membrane by the electrons transport energy dependent phase active transport. Means through pore channels also the aminoglycosides can enter, or they can enter in the cell membrane by active transport also. And inside the cell, they bind to the 30S ribosome or to the 50S ribosome. and some to the 30S or 50S interface, and they prevent the formation of initiation complex, a prerequisite for the peptide synthesis. And there will be interference, there will be formation of monosomes instead of the polysomes, and there will be no assembly of polysomes, and misreading of the genetic code of mRNA will lead to inhibition of the bacterial protein synthesis. This is how, this is the 30S ribosome, this is the 50S ribosome. These are codons, and this codon is misread, wrong codon is there, and that will lead to wrong amino acid coming, and that wrong amino acid will lead to wrong protein synthesis. And this wrong protein is the reason for acidal in nature, bactericidal in nature, and it also inhibits the initiation complex and misreading of mRNA codon. Now, how is the microbial resistance is there is due to, it can be due to failure of antibiotic to penetrate the cell. Means there is efflux pumps, they will efflux the antibiotic from inside of the bacteria to the outside, or low affinity of the drug for the bacterial ribosomes. Means there will be antibiotic resistance genes will be there. There will be ribosomal proteins will be mutated, or they will be altered, and so there will be low affinity for the drug for the bacterial ribosome. Inactivation by enzymes like phosphorylate, they may inactivate the enzymes, antibiotic altering the enzymes, or degrading enzymes will be, they will be activated, and there will be inactivation of the drug by these enzymes like phosphorylate, adenylate, acetylate, and other they will act on the antibiotics. Antibacterial spectrum is basically, these are effective against gram-negative bacilli and gram-positive cocci. And the gram-negative bacilli effective are E. coli, Shigella, Proteus, Citrobacter, and Pseudomonas aeruginosa. These have little activity against anaerobic microorganisms because they need the electron transport chain, electron transport, oxygen-dependent electron transport to enter the inside the microorganisms. And this anaerobic microorganisms do not have the oxygen, so they're ineffective. Aminoglycosides are ineffective for the anaerobic microorganisms. Action against most gram-positive bacteria is limited. They are effective only in some of the gram-positive cocci, and these are not effective in gram-positive bacilli. Now, these are effective against Pseudomonas aeruginosa. Absorption is that these are very polar in nature, highly polar, so they're basic in nature and they're poorly absorbed from the GIT. In the body cavities, they can be instilled, and there will be rapid absorption and unexpected toxicity, that is neuromuscular blockade. All are absorbed rapidly from intramuscular sites by injection. Means intramuscular injection or intravenous injection is given for these aminoglycosides, and these are not taken orally because these are highly polar and they're poorly absorbed in the GIT. Distribution is that they do not penetrate in most cells, CNSI. The apparent volume of distribution approximates the volume of extracellular fluid. High concentration in renal cortex and endolymph and perilymph of the ear. In renal cortex, when these are highly concentrated, they can lead to nephrotoxicity. And when these are highly concentrated in the endolymph and perilymph of the inner ear, they can call vestibular and auditory toxicity can be there. Dysfunction can be there. Subtherapeutic concentrations in the CSF is obtained. Elimination is basically, these are injectable forms, and when they reach the blood circulation, these are eliminated by the kidneys by the glomerular filtration rate. And incidence of nephrotoxicity and autotoxicity is concentration dependent. Dose reduction can be used in case of renal compromised patients. The dose reduction of the aminoglycosides is needed. And these can be removed from the body by the hemodialysis or peritoneal dialysis also. And the total daily dose as a single injection is preferred because they're having the post-antibiotic effect as well as concentration-dependent killing is there. So that will be less toxic and effective in as divided dose regimens. And it will be less toxic and it will be as effective as divided dose regimens. Autotoxicity is the irreversible untoward effect of these aminoglycosides. Dose and duration limited. Vestibular and auditory dysfunction can occur. And auditory dysfunction is basically maximum by the amikacin, and vestibular dysfunction is maximum by the streptomycin. Accumulation in perilymph and endolymph of the inner ear, damage to the hair cells. Ethaclinic acid and furosemide potentiate the autotoxic effects. With ethaclinic acid and the furosemide, which is the diuretic, they can potentiate increase the autotoxic effects. Like vestibular effects are mostly by the streptomycin, gentamicin, both by tobramycin, auditory by amikacin, kanamycin, and neomycin. Maximum by amikacin in the auditory and streptomycin maximum in the vestibular. Nephrotoxicity is that 10 to 15% of renal failure cases are seen, which is reversible in nature. Means accumulation of the aminoglycosides in the proximal tubular cells will lead to mild proteinuria, appearance of hyaline and granular cast. Neomycin is highly nephrotoxic, streptomycin is least nephrotoxic. Potentiation of the nephrotoxicity is seen by these drugs. Means when these drugs are given, the nephrotoxicity will be more with the aminoglycosides like amphotericin B, vancomycin, loop diuretics, ACE inhibitors, cisplatin, and cyclosporin. Neuromuscular blockage is seen in the neomycin more, followed by kanamycin, followed by amikacin, gentamicin, and tobramycin. Streptomycin is obtained from Streptomyces griseus. Deep IM injection or IV can be given. Dose 15 mg per kg per day can be given. Therapeutic uses of the streptomycin is that it can be used in the enterococci strains, in streptococci and streptococci of the viridans group. So it can be used in the treatment of bacterial endocarditis. Tularemia, streptomycin or gentamicin is the drug of choice. Plague, streptomycin and gentamicin are effective. Tuberculosis always used in combination with at least one or two other drugs. It can be used, streptomycin can be used in combination with one or two other drugs. It is the first line of treatment in the tuberculosis. Gentamicin is obtained from Micromonospora purpurae. It can be available as parenteral, ophthalmic, or topical preparations. It is effective against gram-negative microbial infections like Pseudomonas, Enterobacter, and Klebsiella and Serratia. Aminoglycosides never be mixed with penicillins. Therapeutic uses of the gentamicin is that it can be used in the urinary tract infections, because when it is excreted in the urine, basically higher levels of the high levels of aminoglycosides are secreted in the urine. So concentration of these aminoglycosides is more in the urine. So these can be used in the treatment of urinary tract infections. And these can be given in pyelonephritis like aminoglycosides and beta-lactam antibiotics. In hospital-acquired infections like hospital-acquired pneumonia, aminoglycosides can be combined with beta-lactam antibiotics. Meningitis, third generation cephalosporins reduce the need for aminoglycosides in most cases of meningitis. Third generation cephalosporins, these can reduce the need of aminoglycosides in most cases of the meningitis. Peritoneal dialysis associated peritonitis, gentamicin is effective. Bacterial endocarditis in combination with penicillin or vancomycin. Sepsis, aminoglycoside is an empirical regimen. Febrile patient with granulocytopenia and for infection suspected to be caused by Pseudomonas aeruginosa. It is effective, gentamicin in sepsis. Tobramycin is similar to gentamicin. IV, IM, or topical or ophthalmic preparations are available. Therapeutic uses are just same as gentamicin. Superior activity of tobramycin against Pseudomonas aeruginosa 2 to 4 times more than gentamicin, but less effective against enterococcal endocarditis. This is more effective in Pseudomonas aeruginosa, but it is less effective against the enterococcal endocarditis. Amikacin, which is the broadest spectrum which is having, it is preferred serious nosocomial gram-negative bacillary infections like Klebsiella, Enterobacter, E. coli, resistant to gentamicin and tobramycin, and active against mycobacterium tuberculosis also, second-line treatment of the multi-drug resistant tuberculosis. Neomycin is a broad-spectrum antibiotic, and neomycin polymyxin B can be given in irrigation of the bladder Neomycin and polymyxin, bacitracin, these are available as the creams and ointments. Earlier used in preparation of bowel for surgery in hepatic encephalopathy, now preferred, less preferred due to its toxicity. Means it was first used for the preparation of bowel for surgery in hepatic encephalopathy because it was used in hepatic coma because it uses ammonia levels in the body. So ammonia, the urea doesn't get converted to ammonia, so levels of ammonia decreases. So in hepatic coma, it can be used. Now lactulose is preferred and it is less toxic. The most important ADR is intestinal malabsorption and superinfection. Usually, neomycin, freomycetin are usually used topically because of their high toxic potential, because they are having very toxicity. So these are used only topically, neomycin and freomycetin. Thank you. That's all. I hope you understood my lecture. And if you understood my lecture, kindly subscribe to my YouTube channel, that is Dr. Nitika's Pharmacology Discussion. Be happy, be healthy, be blessed, stay safe, stay happy, stay healthy. Thank you.